Welcome to Theoretical Thursday with B&H Wellness. I'm in Jerry Jarvis, registered dietitian, herbalist, and this is where we dive into some of the theory or kind of the background information, go a little bit deeper than we normally do. So I was speaking with a client the other day, and we were laughing about the fact that, a lot of people don't like to get annual checkups. And I probably shouldn't say laughing, but we were just, kind of commenting on it. And I was recalling some other conversations I've had over the years with clients and with people saying, especially men, like, I really don't want to get my annual checkup, and they don't do it, and they don't get annual labs because they really are afraid to hear the results. And it's not necessarily that they're just afraid to hear the results. What they said to me, this patient said to me, was, I don't want to hear the results that I can't do anything about. And when I heard them say that they can't do anything about it, in their mind, they believe they're just going to get bad news and either not be told how to fix it naturally, but just put on multiple medications that, again, they also do not want to do. So with that in mind, I'm just like, So that's if, people go with the kind of the traditional paradigm of wellness, healthcare. And this is where we really think of, you're either, the current healthcare model says you're either healthy or you have a disease. There's no in between, no middle ground, right? So what functional nutrition does, and that's what I practice, what functional nutrition does is it fills the gap between healthy and someone actually being diagnosed with an actual disease or chronic condition. So really where people start to lose function, maybe they don't have a chronic disease yet, or they're not completely sick, but they're just not functioning the way they normally would. They don't have the energy, the vitality. Maybe they don't have they're not able to think as clearly as they were before. A whole bunch of little things. So I just wanted to share, think about reaching out and working with a functional medicine or functional nutritionist. Because I think you really will find that not only will you get answers to questions that maybe you hadn't gotten before, you actually will find solutions to your issues. So step-by-step guidance. Because one of the things that we do in functional nutrition is we really do a root cause analysis. So we look at where you may have inflammation that is just gone awry and what might be causing the inflammation. And it's interesting because this inflammation is what changes how DNA is expressed. And when DNA is expressed differently from what it normally would be expressed as, this is how we end up with chronic conditions. Because remember, DNA is what is telling different proteins how to be formed. And so when it's not expressing properly, we're getting different protein formations, so on and so forth. And this is how we end up with a lot of chronic conditions. So really just getting to that root cause, whether the roots, and this is kind of, if you can imagine, this is a tree. This is a horrible tree, I know. My fingers down here are the roots. The top are the fruits, the top of the tree. So the roots are things like fast food, things like, pesticide residues on foods, things like excessive amounts of sugar, being in a moldy environment. Maybe you work in an office where there's tons of mold, different exposures, cigarette smoke, drug use, all sorts of different things. If you have a sensitivity to gluten or dairy or whatever, these are all things that will cause inflammation in the body. That chronic inflammation will change how DNA is expressed, and then we end up with the fruits at the top of the tree. And those fruits could be obesity, it could be diabetes, it could be cancer, it could be an autoimmune condition. So what we do is we look for those root causes and we show you how to transform them. In many ways you can improve. And then a lot of people are actually able to also reverse a lot of conditions that before they were told there's nothing you can do. So I'm coming to you today just to say, don't feel like all hope is lost. Really reach out to a practitioner, reach out to us. We're B&H Wellness. I'm happy to do a consultation for you if you want to just kind of get an idea of what we might be able to do to uncover. We have a lot of functional lab tests that we do. We also have we do an optimal lab review on labs that you may have already had with your doctor. And we look at these tighter ranges where we can find a lot more things that we can really implement and put in practice right away. So reach out to us, click the link below, and I hope to see you soon. All right, bye.